Hello, welcome everybody, and thank you for joining us today for the webinar How Laboratories Can Accelerate COVID-19 Testing and Issue Results Directly to Healthcare Wallets. I'm Nick Maguire, Chief Marketing Officer at Folio, and I'm here today to moderate this event. Dr. Akankasha Gupta is joining us today as the first presenter. She's working as a Senior Bioinformatics Analyst at cloudlimbs.com. Dr. Gupta is a bioinformatics professional with 10 years of work experience in various facets of research. Her research journey started with the University of Delhi, where she primarily focused on studying the proteins involved in the pathogenesis of cardiovascular diseases in humans. She has authored many research papers which are published extensively in various SCI-indexed international journals of repute. She's been working as a product analyst with CloudLimbs now for 3 years and has been actively working on developing the products to address the evolving needs of the diagnostics industry, including COVID-19. Dr. Gupta, I'd like to extend a warm welcome to you. Okay, before we get started, just a couple of housekeeping points. All attendees are in mute mode, so if you do have a question or you've anything you'd like to add, then please use the chat box down in the right-hand corner. So we are going to get round to answering as many questions as possible at the Q&A session at the end of today's presentation, but we are going to try and keep things to time. So if we don't get round to answering all of your questions, we will get back to you through email. Okay, that's the housekeeping done. It's time to hand over the floor to Akansha.
A warm welcome to all in the webinar on how can labs accelerate COVID-19 testing and issue results directly to healthcare wallets. I am Dr. Akansha and I hope you all are doing well during this COVID-19 outbreak. This pandemic COVID-19 outbroke in December 2019 and swamped the world entirely within a very short span of time. This caused an unwarranted and unprecedented pressure over the entire medical ecosystem and particularly on the value chain of the diagnostic labs. Nobody was ready to handle this vast additional load to carry out the tests on such a large number of samples at a rapid pace. Even after 1.5 years of this pandemic, the ecosystem has not yet come to terms with handling the situation. It is even more aggrieved with the second wave hitting many countries. So we will look at the entire diagnostic value chain and what can be done to contain that. Welcome aboard. Let us take a quick look at the spread of this infection. As you can see over here, the footprints of COVID-19 infection spread quickly, affecting a large population. The map on the right provides a view of the average number of COVID-19 tests conducted daily. Here you can see that despite the continuing efforts for most of the countries, the testing status was very low. This led to a huge disbalance between the actual demand and supply of COVID-19 testing. This high rise in the testing demand as compared to the pre-COVID scenarios took a toll over the existing diagnostic labs where the number of samples being delivered for testing exceeded far beyond imagination. Even the technologically advanced labs with the latest automated testing equipment are currently facing the challenge to tackle this huge overload and to meet the existing demand while retaining the accuracy and reliability of test results. To serve the patients in a seamless manner and to decrease the turnaround time for tests, it is also crucial to have the right procedures in place to share the results with the ailing patients through a quick, secure and HIPAA-compliant channel. Looking at the current situation when the life is coming back to the new normal with back to office, back to school initiatives, the need for COVID testing is sure to go up. As travel requirements are and COVID test reports being mandatory, this is causing an even more burden on the testing labs. Burden not limited to quantity but agility as well. Now the question arises, how do we accelerate the testing process to meet the increasing demand without compromising the accuracy? Also, how to make the test result available in a smooth and secure manner? The answer to all these questions is automation. Automating your lab operations using LIMS bestows you with a multitude of benefits. Now let us have a look at how LIMS can catalyze the testing process. For a seamless experience for the customer, many LIMS vendors are now offering provider and patient portals, using which the providers and patients would be able to self-register and thereby track their testing status. It also helps to receive the reports securely on the portal and download them. Having a barcode generation and auto-sending facility to the patients once they register to the portal makes the sample collection quick and easy. Also, the label printing facility helps to design the labels with the required information on them and print as per the precise needs. When the sample is collected and sent to the laboratory, LIMS helps to manage the incoming packages and the outgoing shipments containing the samples and kits. Optimal utilization of the lab inventory is one of the crucial aspects that is directly associated with the calculation of lab's ROI. LIMS vendors are now coming up with efficient tracking and auto-deduction mechanisms for the consumables and non-consumables. Further, LIMS also helps to receive alerts when the inventory is about to expire and it needs to be restocked. As per the guidelines laid by ISO 15189, it is necessary that the instruments used for tests are properly calibrated. Thus, LIMS also helps the lab technicians to maintain a proper calibration history of the lab equipment. According to ISO 15189 and CLIA guidelines, it is required that the staff who performs the tests must be well trained and competent enough so as to perform them with high accuracy without compromising the quality. Thus, in order to adhere to these guidelines, LIMS vendors are offering facilities to manage the training of the staff and to mark their competency. Additionally, it also helps to track that a job is assigned to the competent staff only, thus helping to adhere to the compliance. So when the tests are assigned to the competent lab technician and the lab technician is conducting the test, there needs to be a way to make the result entry quick and less error prone. Thus, LIMS vendors are coming up with options wherein the test results are fetched directly from the lab instruments such as PCR, ELISA reader, etc. Once the test results are fetched from the instrument files, LIMS also helps in automatic flagging of the test results, whether it be positive, negative, inconclusive, based on the pre-specified cutoffs. This makes the testing process quick and more efficient. After the test results are specified, there needs to be a proper validation protocol for approving the test results. To meet this crucial requirement, a proper validation workflow is now included in the LIMS. While this complete testing process is going on in the lab, there needs to be a mechanism to let the customers know the testing status of their samples. This is very useful, particularly to COVID-19 customers. Thus, a LIMS enables the clients or the patients to keep a track of their sample testing status if it is under testing or the testing is complete. An appropriate LIMS not only helps in accelerating the testing process, it also provides the functionalities that helps the labs to adhere to various regulatory compliance such as HIPAA, ISO 15189, CLIA, etc. Functionalities such as user role-based access permission and encrypted data transmission helps to adhere to HIPAA. Further, LIMS also helps to maintain the audit trail of all the activities with the date and time stamp that helps to adhere to HIPAA and 21 CFR Part 11. Functionalities such as tracking the complete COC of the samples and tests, lab inventory management, and maintaining records of instrument calibration help the lab to adhere to CLIA guidelines. LIMS also helps to comply with the guidelines laid out by ISO 15189 and also 21 CFR Part 11. While switching to an appropriate LIMS helps to accelerate the diagnostic lab operations, one important aspect that needs to be taken care of is how the test results are shared with the clients and patients. LIMS provides several modes of test result delivery, such as it may be via email attachment, wherein the test reports, whether positive or negative, are sent as an attachment through email. Then it may be through the provider and the patient portals, wherein the test reports are released and the respective provider and the patient can log into the portal using their credentials and download the test report. Another quick and handy way can be by delivering the test results on a mobile app that acts as a healthcare wallet to the testee. The testee can use the test results to be scanned and displayed whenever required while moving across the state or international boundaries. We are pleased to mention that CloudLIMS enables the sharing of the test results through all the above mechanisms based on the lab's convenience. Delivering the test results directly to Healthcare Wallet on your mobile is available at CloudLIMS, where once the test results are available, they can be released to the Healthcare Wallet in just one click. Once sent, the testee can open their test results using the digital wallet and can use them as necessary. Now, why should your customers use health wallets for their test results? Let's take a look. Receiving the test results on healthcare wallets offers secure and quick delivery of test results. It also prevents unauthorized access, and of course the results are easy to carry while traveling. It also offers QR code scanning to authenticate the test results and prevent any tampering with the test results. Of course, the consent-driven sharing of the results is also possible. Now let us see how your lab could benefit by delivering the test results on this wallet. So as it can be seen that yes, it offers easy and fast test result delivery and decreased turnaround time. It enables to meet the increasing testing demand, specifically in COVID cases. And finally, increased patient or customer satisfaction. Ultimately, your lab is also happy, lab technician is also happy with the increased ROI and the decreased turnaround time. Finally, we would say, to prevent the spread of COVID-19 infection and to tackle the ongoing pandemic situation, it becomes trivial that the COVID-19 tests are conducted and managed efficiently using a LIMS, and the test results are shared with the testees securely and quickly to a digital healthcare wallet. You will learn more about the secure delivery of COVID-19 test results in the next presentation. Thank you.
Thank you, Akansha. That was great. And don't forget, everybody, that if you do have a question, the chat is open in the bottom right-hand corner, and we are going to get around to answering your questions just after the next presentation. Which leads me neatly on to our next presenter, which is Ben Barnard. Ben is the Chief Commercial Officer here at Folio, and he has over 10 years of experience in B2B sales and customer success environments. He's a specialist in digital transformation and IP protection, and he's responsible for our clients over here at Folio. He's a great presenter and really understands his topic around what we're doing with digital wallets and how they're integrating into the heart of the Cloud's LIMS offering. So without further ado, I'm going to hand over to you, Ben.
Thanks everyone for joining today. I just wanted to take some time to talk to you about not just about the Folio digital COVID-19 test result issuance platform, but to talk a bit about the circumstances around which we've been approached and invited to create something like this. If you look at the unraveling of the COVID-19 pandemic, really the whole world obviously has been scrambling to find ways to deal with it, to enable us to live alongside the virus, to keep the society and the economy running, even if in itself those two things are on life support. And there are many different approaches that have been taken to that, but one of the consistents has been testing. Pretty much universally, testing is seen as a key tool to ensure that those who are not carrying the virus can continue to perform their function that keeps society, that keeps the economy going, even if just at a fundamental level, whilst making sure that those who do test positive isolate themselves to prevent themselves from spreading the virus even further. But the big challenge has been getting that testing infrastructure off the ground and scaling something up that really is unprecedented in its magnitude. And less of a focus has been placed on actually the other end of that process, which is for the individual receiving their test results and being able to assert their status in a way that is kind of in any way consistent even within a region or a nation. And the lack of a structured approach to that has led to a few problems. One is the potential for a lack of trust in some of those results, because they're becoming more and more important, because the permissions that they carry are becoming more keenly crystallized. So, for instance, for international travel, either you need, very often or very soon, you may well need a negative vaccination, or as currently is the case, you need a negative test result at the very least for a lot of international travel. So there's a market that's growing for counterfeit credentials. So how do we tackle that problem? How do we make the test credentials really, really convenient and easy to access, so to retrieve for the individual, and then to assert? So it sounds really straightforward, but actually, if you just have them on a piece of paper, it's very easy to lose, not as well as being very easy to counterfeit. If you have it as a PDF attachment to an email, the process of going and retrieving that information is again quite clunky and quite complex. So how can we bring a bit more traditional user experience thinking and design to that process, and also the privacy and the security element of the transmission of this data? Labs are telling us, diagnostics companies are saying to us, in ordinary circumstances, we wouldn't be sending test results out via email, most probably, or via SMS. It's just the nature of the fact that people really do need them and want them, but in an ideal world would rather a more secure way of providing them with that information. So is there any way that we could be tackling that? And actually, when you think about the types of design that might allow for some of this to these benefits to be realized, it's all eminently possible. And for us, when we were thinking about bringing that to life, we thought the best place to start would be with a great partner like CloudLimbs, who's already providing so much of that core infrastructure upon which labs are relying to perform their day-to-day work. So all the workflow management, all of the sampling and the testing and the result input and the result transmission is all already being performed within these systems. So could we just integrate something that provides those benefits of trust in the legitimacy of the data, of convenience for the user, and of security and privacy by bolting onto an existing LIMS? And this is the result for the individual. What they see ultimately is their credential, and we'll talk a bit more about the process. But a credential like this, it has is configurable, so it has the data that the lab needs, but most often it's the simple fields around name and when the test was taken and the type of test, and obviously the result of the test. A selfie which they can take, which can be put onto the test result, so that someone who's looking at the test result and looking at the person in front of them can link the two. And a QR code, dynamic QR code that can be read by a relying party with a just a camera that will access the original data and present the level of assurance that's required to determine that actually this is a legitimate credential and not a fake one. So if we think about the actual process itself, what we're talking about is, again, no change really if we look at the top row of this graphic from what you would be used to doing as part of your normal day-to-day workflows. So creating patient records, taking samples, creating tests within your workflow management system, inputting the results of those tests and validating them. And then we see a slight divergence from a traditional flow, whereby the patient is actually invited via email or SMS or whatever communication channel you have for them to get their result. So the invite would go out saying, your result is ready, but rather than sending the result itself via that channel, they're then invited to download an application, in this case the Folio application, which allows them to open up that secure container and that secure data transmission mechanism between the application and the laboratory information management system that enables that secure transmission of the test result. And a lot of people ask, well, is putting an app into a, requesting downloading of an app, is that putting too much friction into a process? And we find not. I mean, for some people, inevitably it will be, but generally it's not, because actually the benefits far outweigh the friction at this point in the process. People are going to get their test result, which is compelling. So if this is the way that they want to do it, and you want them to do it for those reasons discussed, then people will do it. And also thereafter, they've got that test result contained within that secure wallet that they can really easily go back in and access to subsequently assert their status. And they get a really good, nice looking credential. Don't underestimate how much people like to have a nice digital card that they can access and present to people. So by downloading the app, they get that benefit of the secure channel, the convenient retrieval of the pass from within the application, and obviously they get the high assurance pass that's going to provide them with those access rights that they'll be seeking. Into that, they get issued their test result, which we saw just now, or some similar representation with their selfie on it, and any subsequent results will get issued directly to the application as well, via notifications. There's no need to go through the whole process again. And then, of course, they can go ahead and use that test result. So that test result they're going to use to assert their status, depending on the specific circumstances and the context in which they find themselves, in the country that they're in, and the job that they work in, and so on and so forth. But it's really easy for a relying party, a person, to come with a camera, a phone, or some other device, scan that QR code, and as you'll see in a demonstration which we can show you shortly, they'll then just receive a pop-up which will notify them of the information that's contained within that QR code that demonstrates the authenticity of the result, and it's something that they can trust. So they can go and enter that stadium, they can go into that hospital, they can get on that flight. So to summarize, you get all these key benefits for the lab in terms of bringing the rigor around that part of your process, accelerating the speed of the issuance of those test results, avoiding people representing results coming from your laboratory that perhaps actually don't, so you eliminating that downstream fraud, ensuring the secure and private transmission of that data, and providing a value-added service direct to patient, as we see the relationship between diagnostics organizations and individual users out there evolving and actually becoming more intimate as a consequence of the pandemic. There's much more consideration coming or being given to the idea of providing a good user experience for individuals. And then for the users, they absolutely get the benefits of that convenience, of that instantaneous issuance of results, the secure issuance of their information, having these effectively digital cards that they can really easily access from within a secure wallet. All the data is stored on the phone. There's no retention of data in our case by folio, so it's all about data minimization. And if you're looking at this or designing something similar, I encourage you to think about how you ensure that no data goes elsewhere. For example, it just either goes securely to the individual, or it's stored within the current source of truth, the LIMS or whatever else, wherever else you store it. And obviously they then get the freedom of movement, not specifically from having a digital credential. They get that from having a negative test result, but it gives them, that high assurance test result, that convenient test result, and that secure and privately held test result that they're craving. So that's a summary of some of the market forces we see at work and some of the evolution of the situation. I hope that was insightful, and would now just like to give you a short demonstration of the Cloud LIMS folio approach to providing a solution such as this for our laboratory partners and our diagnostics partners out there.
I'm logging in with the master admin credentials. So this is the top-end edition of Cloud LIMS, that is the enterprise edition. You can enter here, and once you get your patient information, you can select the patient module. So these are the different modules that we have. You can select the patient modules in Cloudlums, and then using this add patient functionality, you can add the patient information. All the attributes as displayed over here, they are completely configurable. So this form, how it look and feels, that can be completely configured by the master admin. So let's specify patient details, some of the patient details over here, such as first name, last name. Let's select a date of birth, and then an email address. Let's select an email address as this. Then you can also enter any further details like the travel history of the patient or address of the patient. Then there is the consent, and if this consent for sending the results to an external app is yes, then only the results would be sent to the external app, that is Folio. So once you enter all the patient information, you can click here on save, and the patient information, as you can see, it is saved correctly. Now let's add sample for this patient. So for samples, we have a dedicated samples module in Cloudlums, and similar to patient, you can go to the add sample functionality over here to add the sample information. Similar to the patient form, the sample form is also completely configurable, and it depends on how you configure it. And then let's add a sample and associate that sample with the patient that we have recently added, that is John Doe. You can specify any other information as well for the sample, like the quantity or any other information, and then click on save. So once you click on save, the sample information also gets added here. And now when you want to assign, that is Putum 17, now when you want to assign a test, you have the assign test functionality. Here all the tests as applicable in your application will be shown. So you can just select any of the tests and click on assign test. So I've selected RT-PCR, and you can see over here that an RT-PCR test would be assigned. Let's see, yes, so it shows that RT-PCR 16, a new test ID, is created for this record. Now let's go to test management and see if it is really created. So when we go to the test management, here in COVID-19 RT-PCR, we would be able to see that yes, RT-PCR 16 is created. Now if you want to edit any further details for this test ID, like the expiry date of this test is this, or any further details, you can have them edited as well, and click on update. Now when the technician would be performing the test, after the test is performed, they can have the result entry for the test available, wherein they can specify all the information like the CT value or any observed value. Let's say randomly I'm doing it for like this. And then they can also specify the sample testing result, whether it is positive, negative, or anything. So let's specify here as positive, and then click on save results. So now the results are updated successfully. Now we also have a validation protocol available in Cloudlums. So as you can see here, the status is under testing. Now the technician, once they enter the results, they can send the test for validation, whether it be peer review or a final approval, and click on send. Now the approver, that can be a lab manager, medical director, or anyone, they can log in and click on the validate test results. Also they can be they can approve or reject the tests, and they can also specify any validation remarks if there are like results are fine or anything like that, and then they can click on validate. So once the test results are validated, you can see the sample testing status changes automatically from under testing to completed. Now all you have to do for sending the results to Folio or the external app is that for that particular patient record, you just have to click can select that patient record, and you just have to click this action, that is send results. It will ask you, are you sure? And when you click on yes, you would be able to see the message that the results are sent successfully to the external application.
Let's see how Folio receives the test results. If the patient already has the Folio app installed, a notification will be prompted on their screen. If not, an email will be sent. In this case, the patient already has Folio installed, so it is as simple as opening the notification in the device and providing the information requested. The information requested is fully configurable. In this example, the patient is asked to provide a selfie. The application will guide the patient to capture a good selfie that will be attached to their test result. Validation of their email address will also be requested to verify the patient has access to the email address registered in the original lab record. Once both steps are completed, the test result is issued directly in the wallet. The test result will contain key information captured during the test process, pulled automatically from Cloud LIMS platform, like name, date of birth, type of test, date of test, and unique ID of test, for example. This information can be adapted to the specific needs of the lab. Another functionality included in the solution is the dynamic update of test results. Let's suppose this patient had a positive test and 2 days later they got a negative test, so they can be released from quarantine, for example. The patient will receive a notification when the second test result is issued. As selfie and email have been already validated, the patient will simply accept the notification and automatically receive the new test results that will update the previous one. The patient can then check all previous tests received just by tapping more info in the dynamic test result. You might be wondering how someone can verify these test results. The answer is simple. Tests include a QR code that can be read by any smartphone camera, so anyone can see the data shown in the test result through a trusted website. The verifier can also contact the lab, as lab information will be shown alongside test result information. In summary, as you have seen, Folio provides a secure, fully digital, and convenient way to deliver, store, and verify test results for your lab. Thank you very much for watching.
So I've been getting your questions through. Thank you. And Jorge, who is our solutions director here in the UK at Folio, I think is going to take one of the first questions, which has come from Alfonso. So I'm just going to, if you put your questions in the chat, then I can publish them and we can deal with them one at a time. So I'm going to hand this either over to Ben or Jorge, whichever you want to take it. There you go. I'm going to hand that over to you.
So yeah, you were asking about the interoperability element of the credentials. I will give you a short answer, but we can pick up in a more detailed discussion if you want. But our solution is evolving all the time. We are fully aware that there are a lot of initiatives for interoperable credentials, like the ones based on W3C verifiable credentials or the digital green passes in Europe. My short answer is Folio uses similar cryptographic verification methods to these initiatives, so we can evolve and adapt our solution to comply with these initiatives in a short time. But the reality is there are a lot of different initiatives in the world now, and there is no prevalent initiative for that or standard. So we are all the time checking the progress of these initiatives. So we are ready to adapt to all of them. If you have a specific one, like the vaccine credentials approach that is being used in the US or the one in Europe, we are happy to have this detailed conversation with you, or common paths, yeah, as the one you are mentioning. We are aware of all of them, and we have a plan to adapt when they become operative, because they are not yet.
So as you can see that yes, there is a question that before every COVID-19 test, we need to ensure that the instruments are properly calibrated. So yes, it is completely possible in Cloudlums where you can have the calibration and the maintenance history recorded for each of your lab instruments. And if you want to have the calibration scheduled 1 week before, you just have to specify in LIMS that you want to have the alert raised 1 week before, and there you go. Simply the alert would be raised 1 week before the calibration is due, so that you can have the instrument calibration takes place.
That's great. I think there's going to be another one for you, which I'm just going to publish now from Aditi. Sorry, it's quite small, the text there.
Mm-hmm.
Hopefully you can read that.
Okay. Yes. The question is regarding the delivery of the test reports to the testees, and do the reports have an embedded QR code? So yes, there are different mechanisms by which the reports can be delivered using Cloudlums. So talking about the first one, that can be the email attachment, wherein as and when the report is available, so the report can, whether it be positive or negative, the report can be sent directly to the email address of the patient or the testee. And then there can be other methods wherein, like the patient portal, so the patient can directly log in to the patient portal, individual patient portal, and can download the test report from there securely. And the other quick and handy way can be by the mobile app, that is a digital healthcare wallet, that is Folio. So once the test results are sent to Folio, you can have the test reports viewed and also downloaded from the Folio app. And of course, the test reports would have the QR code embedded on that can be scanned to view the test results. So that is completely possible.
That's great. There's still quite a few questions here, and we're okay for time. So I'm just going to put a few more up. There's one here around internet connection. I don't know who wants to take that.
I'm not able to see the quick. Okay, so for the internet connection, and if and regarding the backups, yes, Cloudlums is having a dedicated backup facility where the backup is taken twice daily on different servers, and thus if any disaster happens, then of course you have your application data can be restored to the last backup, so that should not be a problem, and everything can be managed for that.
Wonderful. I'm just trying to work through these questions here now. So, Shinoli, I'm running a COVID-19 diagnostic laboratory. How can I minimize false negative COVID-19 results?
Okay, so as we all know that testing is only as good as it is the competency of the staff or the technician who is performing the tests. So it is very important to have the technicians properly, the technician should be competent enough to perform the tests, and thus Cloudlums enables to have the staff competency managed in Cloudlums, where you can have the different staff trainings managed, and also you have the ability to mark the competency of the staff. And then while job allocation or the test allocation, you can view the competency as well, so that only the competent staff is able to perform the tests. Then considering the high volume that we get in COVID-19 tests, and thousands of patients are there, so it is required that the direct interfacing of the instruments, the lab instruments, whether it be PCR or ELISA reader, so direct interfacing should also be possible. So Cloudlums enables to have the direct interfacing of the lab instruments possible, wherein the lab instruments can be directly interfaced, and all the test results that are available on the instruments can be directly transferred quickly to your lab information system. And this also helps to have a field validation, wherein if there are any non-clinical values that can also be easily rejected. And there can be another methods as well, like instrument calibration. So since we all know that accuracy depends on the instrument calibration, so as I already said that yes, Cloudlums enables to have the instrument calibration in place, so and raise an alert as and when the next instrument calibration is due. So all these methods helps to get rid of the false negatives. Interesting.
Okay, Akansha, I think I'm going to get more for you as well. I'm going to make you work for it today. So can you interface with HIS and get all the patient information from the HIS?
Cloudlums have a REST-based API, so it is able, using that API, it is possible to have it integrated with many of the softwares and other applications, portals, wherein they can use our API systems and can transfer the patient data, and of course the patient information would be retrieved directly in Cloudlums. So that is completely that can be possible using API.
Brilliant. And can you implement rules for auto-validating the results?
While we talk about auto-validating the results, actually it should be possible because by auto-validation, I think that we are talking about the auto-flagging. So there can be certain pre-specified cutoffs, and based upon the internal controls and external controls, you want to have certain kind of validation done. So those kind of rules, once we get from you, we can think of like how it can be incorporated, your set of rules according to your labs, so that it can be done for the auto-validation.
Okay, and Rosignaro here says, are traceability charts available in the software?
So for traceability, yes, actually Cloudlums helps to have the traceability for the samples. So you can have the log of the complete traceability, like the complete traceability for the samples and the tests. So that is also possible in Cloudlums.
Now there's one here which is just a single line question here, so I might throw that open a little wider, because I think there is a potential discussion here which says common pass. Now unless that's a technical thing I'm missing, are we talking as well about the usability of mobile wallets, healthcare wallets?
I think that question was related to the interoperability question we had before. Common Pass is one of the initiatives that actually use verifiable credentials, so probably it was already answered with my previous answer.
Okay, great. I was muting myself then, so apologies for the delay. So we have a minute or two left. So there's a couple left. Can the trace results be validated before releasing to the testee? Is the wallet secure?
Yes.
Proteins there. Yeah.
Yes, actually, Cloudlums have a dedicated workflow that can be managed for the test validation. So before the test results are actually released to the patients, I completely understand that they need to be validated by a medical director or the lab manager. And yes, Cloudlums has that facility wherein once the technician completes the test, they can send that test for validation, and the approver, who may be a lab manager or the medical director, they can log in using their credentials and then view the test results and validate, like they can mark the test results as approved or rejected. And once the test results are approved, then only they can be sent to the patient. So that is completely possible.
And I suppose just to final last point, that is it worth touching slightly on the security of the mobile wallet?
Yeah. Let's answer very quickly. So yeah, the wallet is highly secure. So not only the wallet, so all data shared with the wallet is transmitted encrypted in transit, and the personal information in the wallet is encrypted in the wallet with the user's key. So no one, not even Folio, can access that information. And to add a point to that, so we don't store personal information in the server. And as a company, we are certified ISO 27001. So we take this information security as a really important topic in the company. So yeah, it is very, very secure.
Great. I would ask people that are still on if you would do fill in this survey for us that you will see coming up now, where we just want to get your feedback on the event, the presentation. It will only take a couple of minutes. It'll be vitally helpful for us. But I think we are slightly over time now. So I do want to thank everybody for attending. We are going to follow up any questions we've missed on email, and we can provide you with more details. You did see there was a flash for a demo to be booked. So if you would like to get back to us to book your own personal demo or consultation, then we're more than glad to help. But if you wouldn't mind now just taking a couple of minutes to fill in the survey, would be much appreciated. And then I just want to thank you all again for attending.